Good evening. Welcome to NDWG Democratic TV. Tonight, the past actions shape our future.
Manheru akanaka vana veZimbabwe, tinosangana zvakare padare ramhizha patinotaura nyaya dzakasiyana siyana dzinoitika munyika medu, dzinosanganisira nyaya dzetsika dzedu sevana veZimbabwe, nyaya dzezvematongerwo enyika, uye tinotaurawo nyaya dzeutano hwedu savanhu, uye tinobatawo nhau dzinoitika kumatunhu akasiyana siyana epasi rose, tichibatsirana navadare vedu vanouya padare ramhizha nguva nenguva. Saka regai nditore mukana uno kuti ndisangane navadare vedu vatiinavo nhasi.
Good evening and welcome again to Champions Network TV, proudly broadcasting in collaboration with Mbire TV. I am your host, Mija, and tonight we are discussing digital revolution, how technology is transforming health and social care across the globe. This is a live program, so we would love to hear from you. Share your comments and your questions in the live chat, or send us a WhatsApp message using this number that is shown on the screen. If you enjoy our content, please like, share, and subscribe to Champions Network TV. So let me introduce our guest for tonight. Our first guest is Samyam Islam, a specialist occupational therapist with 20 years experience across acute hospitals, community services, and rehabilitation settings. Throughout her career, she has been passionate about empowering people to live as independent as possible and improving their well-being, overall quality of life. Her experience includes assessing individuals' needs, providing specialist equipment, and recommending both major and minor home adaptation to support safe and independent living. She currently specializes in digital health and care technology, helping people use innovative digital solutions that increase independence, enhance well-being, and give them greater control over health and social care. And
Good evening.
our next guest is none other than Vicky Wang, a service designer with extensive experience in designing innovative public services that improve people's lives. Vicky currently leads the design of the digital health and the care technology services, bringing together local councils, the NHS in UK, and technology partners to develop solutions that help people live more independently in their own homes. Her career spans design consultants, health technology, and logistics, with professional experience across the United Kingdom, China, and Singapore. This diverse international background gives her a unique perspective on how digital innovation can transform health and social care systems. Please join me in welcoming Vicky and Sam. So, And Sam, welcome to Champions Network TV,
Thank you.
collaborating with Mbire TV. Maybe Sam, just greet our viewers.
Good evening, everybody. Thank you ever so much for having me this evening. And I hope you really enjoy our conversation around digital technology.
And also Vicky as well.
Yeah, thank you. Good evening, everyone. And also thanks for having me. Very, very excited to be part of the, like a conversation, and really looking forward to all of the good discussions we're going to have today. Yeah.
And to our viewers, as I always encourage, show your what you can chat with us in the chat box. You can WhatsApp us if you want to actually come in and you've got a question and you want to interact with us in the studio. We have got but limited opportunity for you guys to come into the studio. I'll put the link in the chat box at the appropriate time. But for now, use the chat box and the WhatsApp. Then you can also hear your views across. So maybe let me start with we are at a critical time in our health and social care, and I know you have got 20 years of experience in the as an occupational therapist. How have the digital technology changed how people are supported?
So digital technology is a really new thing to a lot of the older community, and sometimes it can feel very daunting and very scary to have technology in their home to support them with care, because in the UK traditionally you'd have people who've got packages of care, so carers physically coming in and assisting them with personal care, assisting them with taking medication and managing their meals. With digital technology now, we're trying to give that ownership and that control back to the residents of the UK. We want them to engage in how they deliver their own care and have that choice to do it and feel empowered. So it's really, the service I've been working in has been over a year now, and it has absolutely just blown up, and it's been fantastic. We've had a lot of people come in and receive really positive outcomes, to the point that they actually feel like they can manage now with just technology and not needing to have the traditional form of care that the UK provide. So we're seeing lots of benefits that people are having from having very simple pieces of technology, which is fantastic for us.
Thank you very much. If I may just, if you had one piece of technology that you feel this is a game changer, what is it?
Oh. Yes, gosh, that's a good one. There are so many. Our biggest game changer, I would say, our most popular device that we get sent out is the Alexa Show. Now, I know everybody's heard about the Alexa and Google, so they're probably familiar with how it works within your home and making your home a smart home. But in terms of health and social care needs and managing your own care needs, an Alexa Show can bring so many benefits to the older population and even the adults that have got physical disabilities. So we have quite a number of residents that struggle with remembering to take the medication. So with our Alexa Show, we can set up reminders so somebody can have their medication 3 times a day. They don't have to have random people coming in to physically give them that medication. They're in control of taking their own medication. We have so many people who have got partial sensory difficulties, and they struggle to move around their environment in their home. And families feel quite anxious and nervous about how they're managing at home. With an Alexa Show, family can feel reassured because they can do drop-in video calls, so they can touch base with their loved one and check in and see how they're doing. It's such a beautiful piece of tech, and used in such a simple way, can really have a really impactful outcome for that person. So that's just one device that we see a lot of support in helping people to be independent.
Thank you very much, Vicky. We'll come back and draw more from you. And if you are watching and in the UK, I think Vicky is saying Alexa Show is a game changer. I am a witness as someone who assesses people there, and it's one of the key things that I really advocate for my clients to have Alexa Show. Let's now come to Vicky. Vicky, you have worked across the United Kingdom, China, and Singapore in design or consultancy, health technology, and logistics. How have these international experiences shaped the way you look at things and the way you work? Over to you.
Yeah, thank you. That's actually a really good question. So I think a bit about my background. Yeah, I actually grew up in China, and then I moved to UK like to study my master program, and like in between, kind of got some opportunities work in Singapore. So I have to say that all of these three countries are actually really different, like culture wise, system wise, and how things works. Yeah, these are so different. So for example, like in China, I was mainly worked in like internet companies, and the phase is actually incredible fast. Like you shape something and then learn from the real user feedback within days, and then you have to improve it and deliver it very quickly. And I think from there, I actually kind of learned about all of this very agile and faster pace of ways of working. And I would say it's definitely benefited me a lot, like in the work, no matter here or Singapore. And while I was in Singapore, we kind of had the conference actually with all like startups and young like students. We discussed about technology for good. So I believe this is kind of also linked to our topics today a little bit. Like, yeah, technology can definitely transforming how we provide health and the care services, but also we need to be very conscious about like all of the impact from it, because sometimes like for certain group of people maybe not that tech savvy, then there is a chance that they will get left out when we're transforming all of these kind of big services into a more tech based solution. So I think definitely like in Singapore, I got a chance to kind of talk with so many different kinds of peoples and even like government or healthcare technology companies, and that definitely kind of give me like a more comprehensive, inclusive views of these type of things. And then back to UK, I mean, I've been working in this kind of area for like in the past 2 years, basically, and where I think it's kind of like really lucky for me to talk with like real residents and NHS staff and also our social care practitioners. So that actually helped me to build the very like a grounded understanding about what people actually need about health and care like technologies, because I feel sometimes it's never about the technology itself. It's actually like how we use it, how we embed it into the daily service, and how do we ensure that it kind of covers the most of people's needs and improve the service like accessibility as well. So yeah, I mean, like just feel quite appreciate about all of this experience in different countries. I think, yeah, definitely it kind of gave me much more like richer and deeper thought around these areas. Yeah, thank you.
Thank you very much. Let me try to stretch your imagination a little bit. Let's say in one of our viewers there is someone in the developing countries and is wondering how can technology help them in their own space where maybe there's not much infrastructure in place. And is there anything that you can tell that viewer?
Yeah, of course. Yeah, I mean, I would say definitely like the infrastructure kind of is like a foundation of most of like the technologies. And if we're kind of in a more, let's say, limited environment with limited resources or opportunity, I would say let's definitely kind of try to find out what are the most like urgent or most impactful thing we can do. And also, I feel like for technology based health and care solutions, sometimes it doesn't mean like a very, very high tech. It could be something really, really simple, but it depends on how you use it and how you embed this technology into like the existing system. Because think about it the other way. For example, you can be in a very, very good country with a lot of resources, with all of this very high-end like technology. But if the system still don't know how to use it, for example, like a patient don't get enough training or staff don't get enough training, and then they will just leave the technology somewhere, yeah, and they won't use it. And it's such a big waste, right? So I think again, like when we talk about health care and social care, eventually it will always come back to people. And it's kind of like a system levels thing, like when we really want to use the technology and embed it. So yeah, I think like no matter what kind of system, we just need to work around with resources we have. So yeah, I think that will be my answer. Hopefully I answer your question. Yeah.
You have answered it quite robustly, and because you mentioned that it's about our way of life and seeing what tech we can use. Sometimes it's using what we have. For example, WhatsApp is across the globe. How can we use this system to manage the people around us? And I think you mentioned that it's all about system. It's all about people, and it's in other words, it's all about adapting our environment and then use the existing technology that we have to help us manage. Now, let me come back to Sam. I know viewers remember Sam has said the go-to item is Alexa Show. Now, let's come back, Sam, and what are some of the most we have already answered this one, technology that we can use. Many people are excited about artificial intelligence and digital innovation, while others are concerned about privacy, accessibility, data protection, and things like that. How are we balancing this? How are we striking the balance between a lot about ourselves out there so that the tech can help us or AI can help us, while also protecting our privacy?
That's a really good question. So I think when the service was developed, and it'll probably be a little bit about of the work that Vicky had done when they're looking at data protection, all of the technology that was chosen went through a rigorous sort of testing and checking through like a design group. So we had residents from the community, we had different professionals from different backgrounds who would review all the technology to see, A, is it meeting the needs? B, is it accessible to them? C, are they going to be able to manage it? Is it as simplified as it can be for them to be able to have control of their health and social care needs? Everything has to go through sort of the GDPR, the data protection policies are all put in place for every piece of tech that we have, so that our residents' details are completely protected in all ways, so that information is never disclosed. So there was a lot of background work that went on before we even brought them to our residents. So we're always making sure that this is the right product and it's protecting the resident all the way through. We continuously review the technology that we have also. And if we have any new items or devices that we want to onboard, they will go through that rigorous testing and processing of making sure it's the right item for our community and that it can protect their sort of anonymity and confidentiality.
Thank you very much. And I've already developed my own acronym there, the NAS. In other words, does it meet the need? Is it accessible? And also, is it simple enough for the residents to use?
I like that acronym. We might have to steal that. I think we'll steal that.
Yeah, and I think and I can reassure the whoever is listening that the tech that is being provided, one, there's a rigorous background in uh, work done to make sure, one, they are safe to use, and also the data protection is embedded into it. And so it's quite a comprehensive. So you are in safe hands when you are working with either Vicky or Sam, or if you want some advice, you can come to Champions Network TV, and this broadcast will be always there. You can go back and Sam said that. So let me come to Vicky. You currently lead the design of digital health and social healthcare technology services that bring together council, National Health Service, technology partners. What are the biggest challenges that you face whilst we are designing services that truly meet, as we say, that are NAS, in designing services that truly meet people's needs? And what lesson have you learned from different healthcare systems around the world? Over to you.
Yeah, thank you. And I really love that last word. Yeah, we definitely will do it, Sam. Yeah. So I think first of all, I'm probably gonna explain a little bit about service design and what does service designer do. This I believe this is still kind of a new thing. Yeah, so just want to give people a little bit context. So I'm not like Sam, like I don't work as like a practitioner or nurse. Yeah, like when I come to this program, I actually know quite a lot about social care or healthcare. So it's actually a really great opportunity for me to learn about the service and the system. So as a service designer, like my work is mainly to design that end-to-end services, like from a more system and also comprehensive view. So for example, we will go to the community, talk to residents, and understand what are their like expectations or the needs for this type of service. But also we will come to our staff to understand, yeah, because it probably gonna change their daily ways of working. And if you're gonna embed like a technology into a care plan, for example, like I think it will take time for people to kind of learn what type of technology are suitable for different individuals, right? So we will also come to like different service teams to understand their needs. And then there are more stuffs around, you know, like the council side, like NHS, like the National Healthcare System side, you know, like a different kind of organization. They also have like different preference or needs. So the work I did is like to put things together and try to find a balance point and ensure the service and technology is delivered to meet people's demands, but also we're able to run it in a very sustainable way. So giving all of this kind of context here, I would say the biggest challenge is never ever about the technology bit. Yeah, it's actually how you introduce like these new ways of working to our service teams, for example. Like previously, they probably, oh yeah, just to follow the traditional way to make a care plan. But now they kind of need to think, oh, which kind of technology are actually available for my like patients or residents. And each one are so different with different needs. So and also I think for the digital health and care technology program in local council, we kind of try to shape this very like a resident center and collaborative working culture. So that also means that like the big challenge is how do you shape this type of culture with all of different teams and then make it stay in within the organization itself. So yeah, I think definitely there's a lot of lessons and learnings from this program.
Thank you very much. I think one of the key things that we have mentioned there, it's not about the technology, but it's how do we then interpret the need, then use the technology to respond to the needs that we have identified in there. And I think you have also mentioned that the local authority might have different priorities, NHS might have different priorities, and some providers might have different priorities. So as a service designer, it's about how do you navigate these partners to come
Yeah.
up with a product that then meet the nurse.
Yeah.
Yes.
Because the nurse is not about us as a professional, it's not about the organization or local authority. It's defined from the service user's perspective. I like those perspectives and how. Then I think I'm actually enjoying I'm learning myself, and so to our viewers, if you want to have an opportunity either to have a conversation with the intelligent professionals among us, and I put the link in the chat box. You can come and have a feel of being in the audience and ask your question directly to them. If not, you can still continue to put it in the chat, and we will continue to review those questions as we go along. Let me come back to Sam.
Mhm.
This is an unscripted question.
Oh, okay.
You have mentioned that you have been in this role for over a year now, or thereabout.
Yes, in this project, yes.
Yeah. So, what has been the greatest challenge when it comes to the uptake? One, with the professional referring your services to the residents, and when it comes to the residents, them accepting the service. I know myself. I'm in the fond of Alexa Shaw. This is my point. My first point when I get there to see if they are struggling with that is the Alexa Show a solution. So over to you.
That's a really good question. And that's one that we are constantly learning and evolving from every single day. So when this service came about, I think our biggest challenge and learning point is the culture change of the professionals referring. So getting them to understand that technology is part of health and social care needs. It can meet the needs that a traditional sort of care package would have physically having someone going in. It's always hard for anyone at any age to understand technology, but feeling confident and competent in delivering that to your resident is the bit that me and my colleagues are working on every day. We don't expect everybody to fully understand it all in one go, and there's a lot of products out there, but if we can support them with training and development, helping them to feel confident, and then making that suggestion to their residents to get them on board, that's kind of the journey that we're currently on with professionals. So it's a daily challenge, but one that we welcome because there's so much learning that can come from that, and we are more than willing to support the professionals in helping them to adopt it as part of their work ethic. I guess it's making it another tool, a part of their toolkit. So you've got all your traditional assessments that the professionals will do. This is another part of their toolkit that they can add to their assessment process. And that's how we want them to see it, really. In terms of the residents, it's actually been a mixed bag. So there's been quite a lot of positive outcome from it, and I think what's happening is that there is a shift in the technology that's being provided, because now a lot of the residents are hearing that friends of friends of friends have got it, so they're like, oh, okay, that helps you to do that, okay, right, wonder if I would be eligible for that. So we're getting a lot more calls coming in through the front door of our service from residents themselves who are very keen and eager to understand how technology can really support them having control and independence over their own health and care needs. So that's been a really lovely transition. There's always going to be a pocket of people that just don't like tech, and that's absolutely fine. Like, we're not going to push it on people, but there are such simple sort of low level pieces of tech that can really support them, that doesn't require a lot of initiation or a lot of thought put into using that technology. For example, we have a very simple device called a press me button, and it's exactly what it says on the tin. It's just a button that you press and it connects it to their loved one. So if they're home alone, they're feeling anxious or they need support, we can have a command on that button. They just press that and it goes to their loved one, like a text message that you'd see on your WhatsApp, just to say your loved one's trying to communicate with you. They may be saying, I need a cup of tea, or I'm feeling happy, or I'm feeling sad. That's the most simplest piece of tech that we have. So it's not super complicated. And so I think that's probably why we've had a lot of uptake of people really adopting the technology. But we do understand the daily challenge of helping people to support and helping them to understand that technology can support them with their care needs.
Thank you very much. And I think I've learned something there. I need to learn more about this tag, because I think this tag actually doesn't need a response from local authority or anything.
Mhm.
If it can help the resident within the house, you are just in another room, they'll press the button,
Absolutely.
and you know they need something, and you rush to them.
Yeah.
And without these bells or say sensors to say blah blah, I think that's
Absolutely. And it's a very discreet piece of tech. So they're in full control and they get to choose who they want to be their responder, which I think is lovely. It's really giving back to that resident to have that power over their healthcare.
I think it will then compete which one goes on the top with the Alexa. Right. Now, let me just make a follow-up question to you to say we have got our other partners who are the service providers, who manage the care packages. What is their view in terms of sometimes the tech is taking away the number of calls they are supposed to give? So maybe someone needed 4 calls a day because they just need 1 or 2. What is there? How are their cooperation in terms of actually sometimes they may need some evidence to say whether this tech
Yeah.
in terms of
That's been an interesting one. There are many providers that have seen that the technology is there and they're adopting it, and there are many providers that still need support in understanding how that service is being delivered as care. So we've got many projects going on within our service, and we are working closely with doing pilot projects with some of the care providers to see if they can incorporate it as part of their care delivery. So for example, it could be a video call to support someone who needs prompting with taking medication. So that's one of the exciting projects that we have going on at the moment, but that it is a long journey, as we are new into the service, only over a year old. So we're learning and evolving as we go. But that is something we have been very mindful of, because we have been aware that we don't want to overstep the mark with these care providers, because they do deliver a really good service to people. And there are many people that will still need those care providers in place. But also, if a little bit of tech on the side could actually help also, it's giving control to that resident, isn't it? That's the main focus, but we're trying to do it in conjunction with all the different services that are involved with that resident's care.
Oh, thank you very much for such a that we are working with them. Of course, there are some who are hesitant, but there are some are embracing it.
Yeah.
And actually help, because sometimes it also helps them to reduce the number of safeguarding writing that goes
Absolutely.
up there with the when they found someone on the floor and they have
Yeah.
things, all that. Yeah. So let me come to Vicky. We are now winding down now. Right. Vicky, we looking to the future. What innovation, whether you have seen them in the UK or you have read about them somewhere, or
Yeah, thank you. Really, really love this question, actually. I guess I will probably say something boring, and you probably can guess the answer already. I would mention about like the passive monitoring, but also link it with AI. It's like the work we're kind of doing, we're trying to experimenting is a little bit similar to that, but probably not that advanced like within AI stuff. But the idea is to really make the technology application smooth for people. Because as Sam mentioned before, like not everyone's kind of feel confident or comfortable enough to use all of these technologies. And for a lot of devices nowadays, they will still require like a, you know, like kind of an interaction sort of thing. Like, oh, you need to measure your blood pressure, for example, or you need to take these or that readings, or you need to press the button, that kind of thing. And then for example, for some of the group that maybe not that familiar with digital technologies, they may feel quite anxious or nervous about this type of thing. So if we can provide a more kind of like a passive monitoring thing for people, and then with all of the data we collected, we use AI or any sort of other solution to monitor, okay, is there any like a early signed pattern? And then we probably can take more intervention or intervention work so that the people can live like more health and also more independently at home for a bit longer time. So I think this is something kind of like a future I'm actually very excited about and looking forward to. But I think on the other side, I'm also very, very conscious about like data privacy, for example. Yeah, like I think in any kind of like a technology related like a healthcare project, like data and the trust is always like a big topic. Like when we're excited about all of these probably like very smart or high-end solutions, we also need to be very, very conscious about how we collect people's data and use it. Because sometimes you don't want to over monitor that people or make them feel like I don't have any privacy, right? So yeah, I think this is kind of a balance in between. But I think for the near future, I'll be really, really excited to see if we're able to apply this kind of more predictable sort of solution and easy to use technology for people. We can make healthcare like even more accessible, and also perhaps reduce a lot of like potential hospital admissions, and then support people to live in a happy like life, basically. Yeah, that would be my answer.
Oh, thank you very much. I like that linkage to say if we can have some passive monitoring so that we can predict the patterns of how people are living, then using that knowledge then to see how can we design appropriate technology and appropriate intervention to the residents. Let me come to Sam. Let me come to Sam, and Sam, this is now call to action. We have got the residents there who are anxious to embrace this technology. We have got the local authority or NHS who are anxious to not to use their budget. And we have got the tech companies out there who Vicky has told us about, who are progressing and putting some new developments in place, but they also have got research and development budget to manage. What message are you giving, one, to the residents in terms of take up, and also what message are you giving to those who use their space, the local authority and NHS, and the
Oh, Mirza, that's a tough old question you've just asked me there. above my pay grade. I'll give it a go anyway. In terms of the resident, the budget shouldn't affect them because all the technology that we have and provide, if it meets a care need under the Care Act, which is what we follow for the social care, and the NHS Health Needs Act, then the tech is all free. So we don't expect people to purchase the tech individually. The only charge that there could be potentially for our residents is if you come through social care pathway and they get assessed for care. So whether that's the physical care from a care provider or whether it's care from technology, if you need somebody to come out and help you if you have a fall. So if you've got no friends, no family, no neighbours that can come and physically pick you up off the floor, then that means you require somebody from social care to support you in that need. That's the only potential charge that there would be, is to pay for one of the local authority to come out and see you, which is a very, very low cost. So it's not a significant cost to that resident. If you come through sort of the NHS Health Service, you can't actually legally charge anybody that comes through the NHS. So the whole service is free. So it's just remembering that if you've got family and friends, all that tech is free. So it's giving them more power actually and more control again over their health and care if they know they've got somebody that's willing and loves them to do that. So we're opening the door, whereas before traditional care providers, all the costs, there was always some element of cost that comes to the resident. So now we're sort of saying, actually, if you've got a family that can be the person that responds to you when you need support, we're not going to charge you for that. So that's really opened the door, and I think that's probably why more and more people are more interested in having technology to support their care needs. Now, your other question, the big one about budgets through local authorities and how it's all managed. I mean, it's a difficult one. I'm going to try and answer it as simply as possible. There are a lot of stakeholders that are involved when this whole service was developed. So that's from NHS and from social care. And amongst them, they have these discussions where they agree a budget that they think is going to work for the residents for that year, for all the technology, for all the staff. So it's the whole service is what they're budgeting for. And so they predict what they think we're going to have, or our spend is going to be for the year, and then they do it for the following year and so on. So all the providers, all the partners are contributing to make sure that that care is being delivered, because they all want the same outcome. They all want impactful, meaningful referrals to come through for technology, for people to be supported and feel that independence and that empowerment. So that really helps when all the different partners and stakeholders are coming with the same aim. I hope that kind of answers your budget question in the simplest form.
Actually, you answered it by your first statement when you mentioned that the tech is free at the point of delivery.
Yeah.
So the logistics around the whole responding and all that becomes cosmetic, but the key thing is the tech is
free. Yeah.
Right. Just my last question to Vicky. It's all about the professionals, we social workers, whoever, who recommend this tech to the residents. One of the things that is come up when I was speaking to people sometimes, it's the uptake is it's giving me another job to do, another form to fill, another to gather. They would rather, if there was a way of saying like what Sam had said, just press a button.
If only, Mirza.
Yep.
Like magic.
What would you say to that professional?
So yeah, I mean, I do wish there's kind of like a magic wand that you click and then it's all done. But I think, yeah, I think as I said before, like we're kind of the very early stage of to implement these kind of new ways of working and also the new technology solutions. So sometimes like you set up this new service, but the other side of the system sometimes is not ready or like not ready yet. So how you kind of like work with all of like, for example, system limitations, like for the digital healthcare service, like when we're about to launch it last year, we kind of need to think about, how can we ensure like people can make referrals to this new service. And then we realized that, okay, if you need to work on like, for example, some of the system you are using at the moment, like the IT system you're using at the moment, they actually have lots of limitations for us to kind of maybe use an API or any kind of thing to put like a new form or a new way for people to make referrals. So then we kind of need to work with all of these a bit older infrastructure. And then the result sometimes is not the best way, but I think our aim was to create something and make it running fast. And then we will have time to iterate it step by step. So another example is like for the referral form. I'm totally aware of that. Like currently the referral form to the service itself is actually really, really long because some system limitation that people kind of need to double keying a lot of questions or answers. But now we're kind of working on like the system integration. And after that part, like you are actually able to just sort of like one click, and then most of the questions will be done. So I think that's kind of also a reality about like the work we're doing. Yeah, like the technology part is good, but you also need to work around with the environment. So I hope that's kind of the answer.
Sometimes you feel you have not answered, but you have actually answered more than what is expected. Because one thing that you mentioned is it's a work in progress. There is what they call in business on the other circles paralysis by perfection. If you want something to be perfect before you launch it, you will not go anywhere.
Yeah,
exactly. I think this is what we discussed last year before we make the service went live. Like we're fully aware that this won't be like a very perfect service to go, but at least we need to make it run fast. And then we will learn by doing it, and then we keep running. And even for like other kind of exciting projects we're doing at the moment, as I mentioned, like instead of just launch the service like officially, we're doing a very small scale like test and learn sprint just to test if the service pass away data flow system gonna work together or not. So I think this is definitely kind of a working culture saying about the program itself, and I personally really like appreciate and love it.
Thank you very much. Always when things are interesting, that's when the time ticks, isn't it?
Absolutely.
And I was just thinking to myself to say, how will it look like if we have put these people in the room, and we have got an added social worker or someone who refers to you in the room, and someone who uses the text in the room, and we have a conversation around how things are, and hopefully we'll be able to do that on another day. So let me just close the program, and I can't thank you enough, Sam and Vicky, for coming along. I know it's a courage when you come and talk. And we know when we talk on a podcast like this, we are potentially talking to more than 5 billion people. And we have done very well. I can't
Thank you.
thank you enough. sharing your valuable insights and your experiences. And I also want to thank those who have managed to join us online. I know it is the first time. Sometimes you may be hesitant to say, how do I question? Which question do I ask? Sometimes it's your first time to know about this technology. You go and research, you go and Google. When you see us next time, there'll be a lot of questions there to say, oh, you said this on that day, you said this on that day. And thank you for who joined us live on Champions Network TV in collaboration with Mbire. We appreciate your questions, although we are going to get them. And then don't forget to share and like and subscribe to this broadcast. And as I said, this is just the beginning. We will continue to have this conversation. We have got experts in the room who are hiding their skills. Sometimes they were thinking they were not answering the question, while they were answering more than enough. So thank you. So until next time, I am your host, Mija. As always, I say keep learning, keep listening, and continue to engage. And wherever you are watching from us, I say either some say good morning and some good night and some good evening. So to Vicky and Sam, as I said, I can't thank you enough.
Thank you.
It's a pleasure hosting you, and you've done fantastic.
Thank you for having us. It's been lovely.
Really, thanks for having us. Also, very enjoying like this podcast and discussion.
Thank you.
Thank you for watching Champions Network TV. Make sure you click that like button and subscribe. Don't forget to hit that bell icon so that you get the ding 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 every time we do post our videos.